There's no doubt that the way medical messaging is delivered has changed dramatically in the last 40, 50 years. Most people used to get their personal medical guidance from their GP or their specialist. Medical information was the sole province of doctors, and we would cast that information to patients like pearls before swine. What the doctor said went. It was rarely questioned, rarely challenged. How things have changed. Now information is everywhere, but unfortunately much of it is confusing, conflicting and controversial. Coverage of subjects such as HRT, MMR vaccination and the pandemic itself polarizes opinion dramatically. So little wonder we sometimes have difficulty persuading patients what might be the best way forward as regards their treatment. Little wonder they distrust us.